I am Ann Heckman. I am Luke's mom.
I'm Neil Heckman. I am Luke's dad, and this is Luke Heckman. He's a fifth grader here at Adams Central.
Luke is 11 years old. He was diagnosed with autism when he was about 2.5 years old, but from the time he was probably about 3 to 6 months old, we knew that something wasn't quite typical about Luke, so that we went through lots of testing and things until we figured out that it was autism.
So Luke was diagnosed with autism when he was around 2 years old, and like I said, early on we knew he wasn't developing like a typical child, and so we started to take some action to interview and to try to help Luke as much as possible.
Luke likes routines. We try to keep things as routine as normal, keep his day as much the same each day as we possibly can, which is hard because we have 3 other kids besides Luke, so sometimes he might have a meltdown if things don't go the way he's expecting or if he doesn't like where we're taking him. So that's kind of a challenge, is to try to have a family life and do some different things with the other children when he's so used to having a routine. But we've used some behavior therapies and things during his life to try to correct that as much as you possibly can. But with a kid with autism, there's always going to be issues like that when things that are unexpected happen and he gets a little upset. With autism, there's not a lot of medical problems per se. I mean, some autistic kids have those things, but Luke doesn't, so we've been pretty fortunate with that early on. We did do a lot of things through the med center in Omaha, just when we were trying to figure out his diagnosis and make sure there wasn't any kind of dual type diagnosis with him. But at this point, we can manage most things pretty much locally, with physical therapy, speech therapy, occupational therapy, and some behavior therapy. But medically, yeah, we haven't had to do any real extreme things except for early on when we were trying to figure out what his diagnosis was.
And at the school, Luke does see the physical therapist, the speech therapist, and the occupational therapist here at school as well. Well, Luke does some things that are the same as a lot of the fifth graders, but he also does some things that are a little bit different. So any type of interaction with his classmates, Luke definitely appreciates. So he likes seeing his classmates at recess and lunch and in the hallway, and he tries to spend some time in the regular classroom, but he does spend some time in Mrs. Jensen's classroom as well, trying to do some of the other academic things that he isn't able to do in the regular classroom.
I think most importantly is, even though Luke can't talk, Luke understands a lot of things that people say. You have to maybe slow down and maybe not be as wordy with what you say, but most of the time he will understand things, and he especially can understand people's emotions. So if he can tell someone's getting frustrated, and then sometimes that makes him frustrated, and so he feeds a lot off of maybe how other people are feeling and acting towards him. So I think as much as you can treat him like he is a normal kid, that's going to be the best for him. But you just have to maybe slow down and do it a little bit differently than what you would with other kids. And not to be scared of him. If he seems like he's having a hard time or maybe a little upset, you do want to give him some space, because sometimes he can get angry. But for the most part, he just wants to be around other people just like any other kid his age would want to be.
And Luke appreciates interactions even outside of school, so I know a lot of his classmates or people from school have said hi to him when we're at Walmart or when we're at other places, and he does appreciate it. Oftentimes he doesn't respond a lot. He may say hi just by a small wave with his hand that may not be obvious to a lot of people, but he does like those interactions, and we all appreciate his interactions that he has with people, especially outside of school or at school at recess, and a lot of those times when he can't interact with it. Some people ask if autism is something that's contagious, and it's not. So interacting with Luke, you can't catch autism by interacting with Luke. It's just something that Luke has and is born with. So not to be afraid that you're going to catch autism by interacting with Luke.
And I know his siblings always mention too that they just appreciate when people are nice to Luke. So I think, say hi to him, like Neil said, even if he doesn't respond, it's just that kindness goes a long ways, even if Luke doesn't seem to reciprocate.